Today, we're going to talk about the 4 phases of healing, but not in a dry textbook way. We're going to walk through it like a story so you can see how these phases connect and how wounds really heal in the real world. By the end, you'll be able to look at a wound and understand where it is in the story and what it might need next. We're often taught that healing happens in clean, neat stages. But here's the truth. Wounds don't always read the textbook. Sometimes they skip ahead, sometimes they stall, sometimes they backtrack. Let's break it down together and make sense of it. For those who don't know me, my name is Dr. Voltaire, a wound care physician. And one of my favorite parts of this work is helping people see wounds not as problems, but as stories the body is trying to tell us. When you know the phases of healing, you start to understand that story. If you've ever looked at a wound and thought, what am I looking here? Or is this getting better or worse? You're not alone. This doesn't have to be complicated. Let's break it down in a way that's simple, clear, and real-world ready. Here's what we'll cover. The 4 phases of healing explained as a journey. How to recognize each phase at the bedside. What to do when healing stalls. A case that shows how these phases come together. And at the end, I'll share the one thing that can disrupt every phase if we're not careful. Hemostasis. Every healing story starts with the same moment. Injury. Something happens. There's a break in the skin. The body's first response? Stop the bleeding. This is the hemostasis phase. It's fast. Platelets rush in. Clotting factors get to work. A fibrin clot forms like a protective shield. But if bleeding isn't controlled, healing can't move forward. That's why controlling initial trauma matters so much. Once the bleeding is under control, we move into inflammation. Picture it like the cleanup team showing up after a storm. White blood cells come in. They clear debris. They fight bacteria. They signal for reinforcements. Signs of this phase are going to be redness, swelling, some warmth, and maybe even some increased pain. And oftentimes that's okay. These signs means the body is working. But if inflammation lingers too long, if that cleanup crew doesn't pack up and leave, then healing stalls. Once the debris is cleared, the builders arrive. This is proliferation. Fibroblasts lay down new tissue. Capillaries form to bring oxygen and nutrients. Granulation tissue starts to fill the wound. If you've seen that beefy red tissue, that's granulation. That's the wound saying, I'm trying to rebuild, but if something interrupts this phase, like too much pressure on the wound or poor blood supply, the builders can't do their job. Finally, we get to maturation or remodeling. The wound is closed on the surface. The tissue underneath is still strengthening. This phase can take weeks, even months or years. Collagen is laid down and realigned. Scar tissue forms, and the wound regains tensile strength, but it will never be as strong as uninjured skin. Let me tell you about a patient I'll call Miss L. Miss L had a surgical wound that started off well, bleeding controlled and clean incision. In the next few days, she had mild redness and swelling, so inflammation. By week 2, we saw healthy granulation tissue filling the incision line, but then she developed tension at the site from poor offloading. The wound edge opened slightly. The remodeling phase couldn't progress because the wound was under stress. What changed that story? We addressed that tension, better support, better positioning, and healing moved forward again. Healing stalls when one phase gets interrupted. What causes that? Ongoing pressure, poor blood supply, infection, malnutrition. And here's the key. Wounds don't always follow a straight line. They can cycle back into inflammation if something sets them off. Have you seen this before? A wound that seemed to be moving forward, then took a step back? If you've ever stood at a bedside and thought, is this wound stuck? Or where are we in the healing story? You're not alone. The wound will tell you. You just need to learn its language. So remember, healing is a journey. Hemostasis stops the bleeding. Inflammation clears the danger. Proliferation builds, and maturation strengthens. When we know where the wound is in the story, we can give it what it needs to move on to the next chapter. Thanks for watching. If you like this video, check out my next one on how to spot the early signs of stalled healing. so you can step in before progress stops. Stay informed and heal well.